coming out of nowhere. All of a sudden we're complaining of being extra tired, fatigued, depressed, sad. Oftentimes we don't even know that it's a vitamin deficiency. Well, in this video, I'm going to discuss that deficiency. If you're interested, stay tuned. Hey guys, welcome back to my channel. It's Jemecia Capri, the Nurse Practitioner Extraordinaire. And if you're new to my channel, welcome, welcome, welcome. If you're already subscribed, welcome back guys. Thank you for being a part of the Extraordinary family. It's been wonderful, it's great. I hope you guys are enjoying your holiday. I am enjoying mine. I've been doing a little bit of extra eating and hanging out, shopping, stuff like that. I love this time of year. This is my favorite time of year. But in this video, I'm gonna discuss with you a vitamin D deficiency. And you know, we get a lot of complaints about our mood during the winter time, and it's so important that we get the proper amount of vitamin D. So first of all, vitamin D is a deficiency in vitamin D could cause you to have several different ailments or feelings that you just didn't even know were connected to vitamin D. So I thought I'd come on and discuss that with you today. A lot of us don't know that, or let me just say this. Vitamin D is produced in the skin. And in order for it to be activated, we have to get out in the sun and we have to be outside in the elements in order for it to activate and for our levels to be where they need to be. The normal level that we look at in the hospital is between 50 and 100 micrograms per deciliter when we look at your blood level. So we want to see if you're having the proper amount of vitamin D. And honestly, guys, 3 out of 4 of us, 3 out of 4 Americans are not getting enough vitamin D, which is kind of surprising, but I have found that a lot of my patients have low vitamin D. And if I just add that supplement into their regime, then it really helps with complaints that you hear a lot in the wintertime. In the wintertime, we find ourselves getting in the house more, being in the house more, and even now during a pandemic, we're secluding ourselves and not going out as much as we normally do. A lot of people are teleworking. A lot of us are finding that we're feeling down and depressed. We may be having achy bones, we may be having sore muscles, brain fog, and we just can't figure it out. And I'm telling you guys, oftentimes vitamin D deficiency will feel like depression. It will feel like dementia. It will feel like you are absolutely losing your mind. So I wanted to share with you that I want you to be very cognizant of your vitamin D level. So this is the vitamin D that I take, and you can, the recommended dose for anyone above the age of, I believe it's 16, it's 600 IUs, per day. So you want to at least get a supplement that gives you at least 600 and above. Honestly, I normally prescribe to my patients anywhere between 1,000 and 3,000 of vitamin D a day. And that will really change how you feel in general. And so I wanted to jump on and tell you, during Christmas time, there are some times where we don't feel good. We don't feel happy. Not everybody's excited about Christmas like me. And sometimes it has to do with the fact that we're staying indoors more than we normally do. The fact that we're not getting outside, and even though it's winter and the clouds are out and it's a little bit darker, it does not mean that you're not getting exposed to the sun, because you still are getting exposed to the sun. So it's very important that you at least try to get outside sometime during the day. Even if you're not working, get out, sit on your patio, your porch, whatever you need to do to get exposed to some sun. So guys, you can find vitamin D in various foods. If you want to increase your vitamin D with your foods such as salmon, milk, shrimp, sardines, fortified juices have vitamin D. You can also find it in some vegetables, some green leafy vegetables. Let's see, what else? I have it written down here. Eggs, you can find it in. And if you are like me I only eat 1 meal a day, so I can't get all of my vitamins in that meal. So I take a lot of supplements. So if you feel like you need a supplement, get some vitamin D. You can go to your local pharmacist. You can talk to your primary care provider and get some vitamin D, at least 600 and above, and make sure that you don't get too much, which probably anywhere between 2,000 IUs to 3,000 would be too much to be taken a day unless your provider is prescribing that to you. So that's how much you're going to need. And yeah, so if you don't eat it, then get a supplement. Of course, you can get a supplement also because oftentimes you don't have the proper level of vitamin D in your system. So you do want to take a supplement. And I did show you guys that this is the one that I take. This is the one that I like. It's a gel cap, and this one, it's really small, and it looks like this. Hold on. Okay. All right, so that's what that looks like. And this one is 1,000 IUs, and sometimes I'll take 2 of them because that's what I do. Yeah, so yeah guys, I wanted to tell you about that. Now if you're a provider, or if you're a nurse practitioner student and you get a case study that is giving you situations like depression or insomnia or something like that along those lines, dementia along those lines in the elderly, use vitamin D deficiency as one of your differentials. So that's something to think about as well, because it does present that way. Thanks for stopping by. Thanks for watching, guys, and take care. Hang in there with me, guys. Thanks for watching. Take care.